Hi, my name is Maida Trumig, and I will be talking about sickle cell anemia today. What is sickle cell anemia? Sickle cell anemia is an inherited blood cell disorder characterized by defective hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen to the tissues of the body. Sickle cell anemia inhibits the ability of hemoglobin in red blood cells to carry oxygen. The difference between normal hemoglobin shape and sickle cell hemoglobin shape. Cells with normal hemoglobin are smooth, disc-shaped, and flexible, so they can move easily through the vessels in our bodies. Cells that contain sickle cell hemoglobin are stiff and sticky and form into a sickle shape or a crescent shape when they lose their oxygen. These cell clusters make it hard to move through the blood vessels. These clusters then cause blockages, stopping the movement of healthy and normal oxygen-carrying blood cells. As seen in this picture, you can see on the left side is the normal, healthy red blood cells moving through the vessels, and on the right side, you can see that there's sickle cells mixed with red blood cells, and you can see there is a blockage caused from the cluster of sickle cells, and you can also see the difference of the shapes in the two. The survival rate of normal blood cells versus sickle cells. Sickle cells can only survive for about 10 to 20 days, while normal blood cells can live up to 120 days. People with sickle cell anemia have most or all of the normal hemoglobin, or HbA, replaced with sickle cell hemoglobin, HbS. This type of sickle cell disease is referred to as HbSS. It is the most common and most severe form of the sickle cell variations. Severe and chronic anemia is a common characteristic for people with HbSS. The genetics of sickle cell anemia. Sickle cell anemia is inherited in an autosomal recessive pattern, which means that both copies of the gene in each cell have mutations. The parents of an individual with an autosomal recessive condition each carry one copy of the mutated gene, but they typically don't show signs and symptoms of the condition. So a person can be a carrier of sickle cell anemia, but doesn't have symptoms or signs of the disorder. When two people who are carriers of this autosomal recessive condition have a child, there is a 25% chance, or 1 in 4, chance that the child will have the condition, a 50%, or 1 in 2 chance that the child will be a carrier, like the parents, and a 25%, or 1 in 4 chance that the child will not have the condition and not be a carrier. How is this disease caused genetically? Sickle cell anemia is caused by a mutation in a gene called hemoglobin beta, or HBB, located on chromosome 11. And this mutation is also shown in the picture on your right. Both females and males can get this genetic disorder, so it's present in both genders. And the gene is immediately expressed in sickle cell anemia at birth. Phenotypic effects of sickle cell anemia. Relatively higher hemoglobin levels with clinical display of increased frequency of pain, acute chest syndrome, and avascular necrosis are the most common phenotypical effects of sickle cell anemia. Acute chest syndrome is chest pain, fever, low oxygen levels, and lung infiltrates. Avascular necrosis is the death of bone tissue due to lack of blood supply. The molecular level of celiac anemia is the difference in hemoglobin. Hemoglobin is not present, causing the shape of the red blood cells to change. Red blood cells are smooth and disc-like shaped, while sickle cells are sickled or crescent shaped. And you can see this in both of the images on this slide. The first one shows how it goes through the different vessels of the body, and you can see both regular blood cells and sickle cells going through the body. and then the bottom one is more of a microscopic view of both of the cells. Symptoms of sickle cell anemia are periods of pain that can last a few hours to a few days, blood clots, swelling in hands and feet, joint pain that resembles arthritis, chronic nerve pain, life-threatening infections, and of course, anemia. There's not really much you can do for celiac anemia other than just manage the pain. And so most management of sickle cell anemia is aimed to avoid pain episodes, relieving symptoms and preventing complications. Treatments might include medications and blood transfusions. Some of the medications given are hydroxyurea, L-glutamine oral powder, Atacovir, pain-relieving medications, and voxelotor. These are all basically for long-term pain symptoms. Interesting facts about sickle cell anemia. So how rare is sickle cell anemia? Sickle cell anemia affects millions of people worldwide. It is not a very rare disease. In the United States, sickle cell disease is the most common inherited blood disorder, affecting about 70,000 to 80,000 Americans. Sickle cell anemia is estimated to occur in 1 in 500 African Americans and in 1 in 1,000 to about 1,400 Hispanic Americans. So symptoms. People born with sickle cell anemia obviously have it at birth, but the symptoms don't really appear until about 5 or 6 months of age. This is when acute pain, fatigue, and jaundice may develop. So where did this originate? Sickle cell anemia originated, or actually sickle cell diseases, including sickle cell anemia, originated in at least 4 different parts of Africa. Life expectancy. About 40 years ago, the average life expectancy of a person with sickle cell anemia was 14 years of age. Now people live to be over 50 years old with sickle cell anemia, although that is still about 20 years less than non-sickle cell patients. So obviously there isn't an actual treatment for this, but there are doing things to prevent worse symptoms in children. So some of that is when a baby is born and diagnosed at birth, they take a daily dose of penicillin until age 5, when the risk of life-threatening bloodstream infections decrease. But yet again, there is still no actual cure. But there's one option that may offer some promise. It's a type of bone marrow transplant called hematopoietic stem cell transplantation, which involves transferring healthy blood-forming cells from one person into bone marrow of another. This procedure is mostly done in children prone to strokes or chronic pain. It is also very rare. Only 1 in 10 kids with sickle cell anemia can find a donor. Now, sickle cell diseases, there is quite a few. There's actually 6 different types, including sickle cell anemia. And as I said previously, HBSS, which is sickle cell anemia. Both your parents passed on an abnormal sickle hemoglobin gene. And then HBSC, one parent passed on an abnormal hemoglobin S gene, and the other parent passed on a gene for abnormal hemoglobin C. And then HBS beta thalassemia, one parent passed on an abnormal hemoglobin S gene, and the other parent passed on a gene for beta thalassemia. HBSC SD, one parent passed on an abnormal hemoglobin S gene, and the other parent passed on a gene for abnormal hemoglobin, gene D. And then HBsE, one parent passed on an abnormal hemoglobin S gene, and the other parent passed on a gene for abnormal hemoglobin E. And then the last one is HBsO. One parent passed on an abnormal hemoglobin S gene, and the other parent passed on a gene for abnormal hemoglobin O. Alright, this is my works cited page. Thank you guys for listening. I hope you learn more about sickle cell anemia. Bye.